and don'ts about pediatric COVID vaccinations. Requesting you all to shoot your queries after the completion of this address to the parents. Thank you.
Good morning. Good morning, everyone. This is Dr. Manish, pediatrician from Pranaam Hospital. At the outset, I would like to wish all the lovely children out there a very, very happy Children's Day. Today, we'll be speaking very briefly about COVID, which we already know a lot about, and a bit about COVID vaccines and the apprehensions of the parents. So COVID, as we know, in children is largely asymptomatic. That is a very good news for all of us. So basically, when do we suspect COVID in children? Generally, first thing is when there is any positive member in the family. That is a strong suspicion for children having COVID, because most of them are not having symptoms. Second, they can have very mild symptoms like fever, cold cough, or dry hacking cough or something. The second thing is, when do we test children with COVID? Generally, asymptomatic children, we tend to avoid doing any tests at all. The strongest suspicion for doing a test in COVID for children is when there is a family member who is positive for COVID. And usually what is the test done is the routine RT-PCR. There is no separate test for COVID in children. COVID in children, like adults, is again divided into the same mild, moderate and severe disease. Mild disease is asymptomatic, or maximum they can have little bit of fever, cold cough, but the saturations are good. Whereas moderate disease, again they can have fever, cold cough, saturations could be hovering around 90-95. Severe disease, children have high degree fever, they have breathing difficulty, and the saturations are usually below 90. So that is where they require medical attention. The other mild disease and maybe moderate disease could still be managed at home. The other severe disease has to be managed in the hospital. This is about COVID. Nowadays we are seeing a new entity which is called as multi-system inflammatory syndrome in children, that is MISC. This we are seeing in children, and mainly it is in children who have been affected by COVID either symptomatically or asymptomatically, and usually we see it after a few days of COVID, that is after 1 month or 2 months of COVID. So generally, what is the MIS? MIS, usually the diagnostic criteria are children who are not responding to any treatment and they have fever for more than 3 to 5 days. Most of the children present that they have been taking antibiotic and nothing is happening, and usually these children are a little dull looking, they are very lethargic. And some children have a little extreme also, they have shock, I mean they have rashes on the body, they have shock, their heart is involved, so they can also have breathing difficulties. And we generally suspect this when children have fever for more than 5 days, and by some blood tests like their inflammatory markers are raised, CRP, there is something called D-dimer which is raised, and of course when we do a serology like IgG or IgM of COVID, this comes positive. So this is about MIS, but luckily for MIS the treatment is there, and most of the children respond to treatment. There are some children require steroids, and some children who have little involvement of the heart will require immunoglobulins. But most of the children, 99% of the children, recover from MIS syndrome. Let us now go to the burning question of vaccines in children. First and foremost, the vaccines presently in India are not being given to children. There are a lot of queries coming to us that vaccines have been announced, so that people are thinking that vaccines have already started. Some places they are giving vaccines, so queries are coming. But right as of now, Government of India has not given permission to start vaccination in children. So vaccines basically in COVID are of two types. One which has already been approved by the government, that is the Zydus Cadila vaccine, or it is called Zycov-D. This is generally given for children about 12 years of age and 12 to 18 years of age, and this is an live vaccine, it's an RNA vaccine. So basically this vaccine, there is a genetic code of the virus which is in the vaccine, which when the vaccine is injected in the person, this code induces an immune response, and that is how the children get immunity. This is basically supposed to be a needleless vaccine, and because it is just subcutaneous, the needle just pierces the skin and goes and comes out. And this is a 3-dose vaccine. Zydus vaccine is a 3-dose vaccine given on day 0, on 28th day, and on the 56th day. This is about the Zydus Cadila vaccine, which is still, I mean, we are waiting. Probably in a month or so, we should be able to get the vaccine or roll out the vaccine for children. And the second vaccine is the very own Indian vaccine, the Covaxin, which is developed by Bharat Biotech. This is a basically inactivated vaccine, which is given to children from 2 years to 18 years. This is for 2 years, and recently Government of India has approved this vaccine also. We are just waiting for other clearances and the logistics for the vaccines to be rolled out to children. Probably that also may take a couple of days or maybe within a month or two. We should be getting this vaccine. This is only a 2-dose vaccine, and this of course is a needle vaccine, and this is given on day 0 and day 28. That is almost 1 month after the first this one. Vaccines are, as of now, the trials which have been done for the vaccines, these are no different vaccines, they are the same vaccines as in adults, and the dosage also, as of now, we believe that would be the same dose. We will have to see what is the outcome and what are the guidelines which we get from the government about the dosage of the vaccines. Now coming to the side effects. In the trials which have gone, we have seen these vaccines, the follow-up of this patient for the children who have been given these vaccines during trials for almost 6 months now. All the side effects are the same as any other vaccine. Children have pain at the site of the vaccine, they may have light fever, or maximum they may have a bit of lethargy or a little dullness for that to 24 to 48 hours. We have not seen any major side effects in the children as of now. Now, who all has to be given the vaccine? The major concern about parents are, my child is not well, he has been sick throughout from the childhood, he has got some disease. Some children can be having kidney diseases or cancer, or they can be having asthma. So these parents get apprehensive whether I should give the vaccine, my child can fall more sick after giving the vaccine. But let us be very clear in this, these are the children who require the vaccine. These are the children which we should prioritize in giving the vaccine, because we don't want these children to get affected by COVID. In case these children are affected by COVID, we know that the consequences could be sometimes very bad and disastrous. So all parents who are apprehensive that the child is weak, the child is sick and other, please take an opinion from the pediatrician, and if everything is okay, prioritize your child to get the vaccine whenever it is available. Let us go through some do's and don'ts. Basically, do's and don'ts, parents have been taking vaccines for their children, everybody knows. The most important these ones are children, don'ts are, when a child has fever or high degree fever, better to postpone the vaccine for a day or two. Second thing is, if the child has got any allergies since childhood, please inform your pediatrician about the allergies so that he can decide whether the vaccine can be taken or no. Or if the child has got infection, obviously the pediatrician will decide. So the key thing in pediatric vaccine is, please consult your pediatrician before giving the vaccine. They have to see and judge and then go for the vaccine. Apart from that, also when you go for the vaccine, please ensure to tell your pediatricians all this, or if the child is on any medication or anything. And now the final thing which I want to tell is, this is about the vaccines, these are available. The final thing which I want to tell is, right now the vaccine is not available. Whenever it comes, everybody would be informed. And the most important thing is about the third wave. Everybody is worried about the third wave. All parents are worried about the third wave. Fortunately, we have seen in the first 2 waves, which were quite severe, children have been minimally affected. So we are not expecting any drastic this ones in the outcome or in the future that children will suddenly start getting the disease. So please be relaxed. We have seen 3rd, 4th, 5th waves also in other countries where children are still not affected very badly. So we are hoping, and now with most of the population being vaccinated and hopefully children vaccination being rolled out, we hope that the third wave doesn't come, and we hope that the children would not be affected. But saying this, I would still advise the parents to keep all the precautions in place. Continue wearing your mask, whatever hygienic precautions, sanitizing hands and all. Please continue doing that, and we hope that we will not get a third wave and we have our children go back to schools and lead their normal life, which we have seen they have been suffering over the last 1 or 2 years. Thank you, everybody.
There's a question from Mr. Sanasar. She is asking whether she can take the vaccination if her kid has already vaccinated for flu vaccine and the time period is less than 6 months.
Yeah, that's a good question. Basically, any child who has been taking the vaccines, regular vaccines which are there in the national immunization schedule, have to go ahead and take those vaccines according to schedule. The only thing is, if their child has taken a vaccine, within 28 days of taking the vaccine, we don't give another vaccine, whether it is COVID vaccine or any other vaccine. So if their child has taken influenza vaccine, it is better to wait for 1 month before we go for any other vaccine or the COVID vaccine.
There is a question from Dhanvi. She is asking whether the flu vaccine is compulsory for every year.
Well, flu vaccine is something which prevents common cold or flu-like symptoms. It is more useful in children who are already having repeated episodes of cold and cough, or children with asthma or childhood reactive airway disease, or children who are having some immunocompromised state like kidney problem, liver problem, or cancer or any such thing. So these children, we strongly recommend that they go for an influenza vaccine. But now with the COVID season, we are recommending all parents to take the influenza vaccine, because in case the child gets COVID or if he is COVID positive, we don't want him to be infected by COVID by influenza at the same time. We don't want the influenza to complicate COVID and then make it more dangerous. That's why we are advising them to take the influenza vaccine for whatever protection it gives.
There's a question from Ramya Sri sir. Can we send kids to school before vaccination, as all schools started offline classes? What do you advise?
Well, the thing is, like I have told you, we have not seen any severe illness in children and in the first and second wave, which were quite severe for adults. We are not hoping that the children will develop any severe symptoms, because children, for whatever reason, are protected against coronavirus. We have seen that very well. Now with most of the adults being vaccinated, also carrier of the disease, or the disease getting carried over to other people, also has drastically come down. So with proper precautions, I would advise that they can go to the school, attend school. There should not be any problem for children attending the school.
There is a question from Mr. Manoj Kumar. There are any food restrictions that we can do before and after vaccination?
No, basically vaccines, any vaccine, it's the same. There is no food restriction before vaccine. We preferably tell the parents to take the child with the after feeding something only, and preferably after giving lot of fluids. It's like any other, there is no restriction as such.
There is a question from Mr. Sylvester. Is Covishield vaccination being developed too?
Covishield, I mean, I'm sure there are trials going on, but as of now they are still in a very nascent and early stage. We still do not have information, but there are trials going on world over, and soon we will come to know about Covishield availability in children too.
There is a question from Mr. Sudhir Kumar. If kid got a record of COVID, when do we need to take influenza vaccine?
I mean, he says if the child has got COVID, then basically we tend to postpone the COVID vaccine for at least 1 month. Sometimes we say we at least postpone the vaccine for 2 to 3 months. Minimum there should be a gap of 1 month.
There is a question from Sri sir. Is it mandatory to take COVID vaccine?
Well, right now we have the only thing which is going to protect us from COVID disease is COVID vaccine, and we do not want any other untoward things happening with the children or to adults. So it is better to take the vaccine. We have seen over the last 1-2 years adult vaccines have been safe. We have been giving them for more than 1 year now. So we are hoping even the children, so at least if we give the vaccine to children, we can be assured that they would not get the COVID disease or any complications of the disease. So that is our best bet right now for fighting the disease. So I recommend everybody should go ahead and take the COVID vaccine.
There is a question from Ujjwal Shah. Can 3 years old be vaccinated?
It all depends on the vaccine which is available in India. Right now, suppose if only Zydus gets approved by the government or DCGI, then only the children above 12 years can be vaccinated. Once the government gives full approval of Covaxin, then any child above 2 years can be vaccinated with Covaxin.
There is a question from Anand. If any Covaxin child have any reaction?
Till now in the trials, like I said, most of the reactions were mild, like after giving any DPT or any other measles vaccine, the same thing. Children had fever, body pains, a little bit of malaise or lethargy that was lasting for 24 to 48 hours. We have not encountered any major side effects in the trials till today.
There is a question from Srikanth sir. Kids using masks for complete day in school, will be it any issue?
Well, we are recommending them to use a routine mask, either the surgical mask or the N95, but we have seen people wearing masks for even 24 hours and not having any issue. So I don't think those 6 to 8 hours or whatever the children are in the school should cause any problem in wearing masks.
There's a question from Ms. Vijaya. What would the symptoms in kids if they are affected with COVID?
Symptoms, I said mainly the symptoms which we have seen till now in children with COVID are only mild fever, dry cough and cold. Some children have loss of smell and taste also. And very rarely we see if the COVID is like bad or severe disease, then children develop pneumonia, breathing difficulty, high degree fever, lethargy. Some children have fits also. So those are in very extreme, less than 0.1 or 1% of patients.
There is a question from Sylvester. Are the current child vaccine activate for lifetime or later giving the boosting could be needed?
If you are talking about COVID, right now we do not have any long-term studies because it's a very new disease, just 2 years. So whatever vaccines we are recommending for short term. Depending on the further studies or trials which go on, we will come to know how the response is after 1 year or 2 years. And if the response is coming down, definitely they will recommend some booster doses.
There is a question from Mr. Manoj. What is the chance my child develops COVID after COVID vaccination?
That's a good question. I mean, COVID vaccine is protective, like we have seen most of the places, it is around 80%, 90% protective. So even then, there are people, adults or children who can develop COVID disease. You have seen a lot of people who are vaccinated and develop COVID positive. That is quite this one, but we see most of them or none of them develop any complications of COVID. So that is the most important thing about the vaccine. That when you take a vaccine, you may develop again mild fever or something, but the chances of developing any complications or lung involvement or pneumonia with COVID is very, very, very rare.
There is a repeated question, sir. Vaccination for below 2 years.
That has not yet come. I think even the trials, I'm not sure where they are going on, but that is going to take a little time. And generally, below 2 years, we have not seen any cases also which have been affected. I mean, even if they are positive, we have hardly seen any complications there.
There is a question, sir. Can the kid be given flu vaccine if the kid is not given vaccination in the last 3 years?
Influenza vaccine can be given anytime, even if they have not taken vaccine in the last, even adults can take influenza vaccine. So it's got nothing to do with whether you have taken vaccine in the last 1 or 2 years. If you have to take the vaccine, you can take it anytime.
There's a question from Sri Devi. How many days of space to be given between influenza and COVID vaccination?
Between
already vaccinated with influenza for the kid.
Between any vaccines, you have to give a gap of 1 month. 28 days is the minimum. So whether you are giving influenza, measles, DPT, anything, there should be a gap of 1 month between 2 vaccines.
There's a question from Syed Aslam. Can we club Zydose and Covaxin? I meant first dose Covaxin and the second dose of Zydose. Those
studies have not yet come. We have not yet done any studies about combining vaccines. So present recommendation is we have to go with the only whichever vaccine has been taken on the first dose. The second dose also we recommend them to take the same vaccine.
When will the vaccination will be available, sir?
That we have to see. See, the vaccine technically has been approved by the government of India, both the vaccines, Zydus and Covaxin. But there are a lot of things which the government has to look into, like basically availability of the vaccine manufacturing, the logistics, transport and other things of the vaccine. And second thing is whom to give, depending on the availability of vaccine, whether to immunize only the immunocompromised people or the sick children or to give. So there are a lot of things. So I am sure the government is working up those things. Probably in a few days we will be getting some good news about vaccinations in children.
I would like to thank Dr. Manish Gour for addressing the parents with valuable information. For further details, please visit Pranaam Hospital. Thank you.
Thank you very much.